You might be inclined to say about our next topic, what's the big deal? Everybody worries. But when it's called something like general anxiety disorder and it has a name, it is something to start taking seriously. Dr. Jorge Porras is here with us today from eStudy Site to talk about that. Again, everybody worries, so at what point do we begin to worry that maybe we have a problem here?
Right. You know, we all worry, and worry is just this feeling of something coming up, an impending task that you need to do, and worry is good because it makes us do that
thing. It's a motivator.
Right.
Okay.
So, but then when you get to the point of excessive worry, where you can't control the things you're worrying about, and I'm talking about daily things, my health, my family, my finances, and those things stay in your mind over and over and over, that can lead to some physical symptoms like inner restlessness. You get sleep deprived because you don't sleep well at night. You may lose weight, and it might start to look like depression, and oftentimes it goes into a depression. And we know that generalized anxiety is probably about 5% of the population is affected by it, and it's mostly women. And it is something to take seriously because of the other medical problems that can come along with it.
So you mentioned some of the symptoms that you would look for there.
Right.
What would then some of the treatments be?
Well, some of the treatments are similar to those that we treat depression with. And some of the other treatments are kind of the mild tranquilizing medications that we used to use, like your Valiums and so forth. But those can become a problem themselves.
Sure.
With addiction. If you're elderly and you take it, it leads to falls, and you don't want to break a hip and be in the hospital. So it's a nice area to study because there are some newer drugs in the pipeline that are trying to find treatments that don't have those kind of negative side effects.
So a good subject then for clinical trials.
Yes, definitely. And we are doing some of those trials ourselves, and it is including general adults and elderly. So it is an area where there's a lot to learn about it, and it is a serious condition.
eStudySite.com is where folks would go for more information about the clinical trials.
That's right.
And also for more information about this in general.
In general, again, most people would probably see their family doctor first and say, I'm worried too much, I'm getting no sleep, and I can't get these thoughts out of my head. And generally they'll be seen by their family doctors, who will probably start the first round of treatment. But if you want some specialized care, you can always look into a clinical trial.
Very good. eStudySite.com, again, is the place to go for that. eStudy Site. Dr. Jorge Porras, it's great to see you. It's always interesting.
You're welcome.